Hello everyone and welcome back to Clinical Psychology Community UK. I am Holly and I'm currently a first year trainee clinical psychologist training on a course in the UK. So today I will be covering lots of information about placements because placements are a really key part of training, and I will talk you through some of the things that we're expected to do and some of the course requirements. This seems to be fairly consistent across the courses, but the courses will vary in the particular bits that they ask you to do. So obviously this is just really about my course, but it will give you a bit of an outline of kind of what is expected. So some courses, as I say, do vary in terms of like the layout of placements. So ours is for the first year, we do 2 6-month placements. One is working age adults and the other is older adults. In the second year, it's 6-month placements again, and that will be learning disability. And then the other one will be like a CAMS or children adolescent placement. And then in the third year, generally there's a year-long placement that's kind of like an elective one based on kind of the things that you might want to specialise in. But it might, in some cases, I think, be 2 6 months. So slightly different to what they've recently done because the numbers have increased. Instead of doing 2 6-month placements, lots of us are on split placements. So mine, so far, my working age adult placement has been in a pain service. And that's what I've been doing for the last few months. And then when I get to 6 months of that, I go down to 1 day a week there, and I go to 2 days a week older adults. So then it becomes a kind of split placement for the rest of the academic year. So essentially, even though my pain placement is kind of a year long because I go down to that 1 day, you still have to do all of the requirements as if it were a 6-month placement. So for me, placement days are Monday to Wednesday. So it's every week, Monday to Wednesday. And then generally our teaching days are Thursdays and Fridays, with study days either being on the Thursday and the Friday. So let's talk about some of the basic placement requirements then. So there's a few. So I will try and go through them all for you. So generally we need a supervisor. So this is typically a clinical psychologist, but could be another type of practitioner psychologist, so counselling or health or forensic even, or a psychotherapist, which generally at the moment seems to be CBT, but could be a psychotherapist of any kind of modality. So the supervisor essentially is clinically responsible for you when you're on placement, and is also there to kind of support you and make sure that you develop all the competencies that you need to develop and tick those boxes and get some really good experiences. They're also the person that provides you generally with clinical supervision while you are on placement. So then we have to agree a placement contract. So this is ideally done within the first 2 weeks of your placement. Your supervisor and you meet and you set out a contract kind of detailing who can provide support if they're not around, where to go and when. It's kind of just like a normal contract. So what your working hours are, where you're expected to be, and basic details like who to contact, book a room, stuff like that. It also contains a supervision contract. So we'll have like the frequency of supervision, the structure, the content, and kind of how you like to be supervised, what the boundaries of that supervision are. And it's a really key document, which every placement you have to have one of those, quite rightly. So thirdly, moving on to the thing that I probably spend most of my time on, because it's something that you log all of your clinical experiences, it's your clinical logbook. So the course do provide us with like a blank template one, so that's really useful to know exactly what needs to go on there. But essentially it details all of your experiences while you're on placement, and some of those ones that when you are spending your time on placement, it might be like additional training that you've done, that you've delivered. It could be involvement in meetings. It has all those different kind of other competencies as well as your clinical stuff. So clinically, you log all of the observations that you've completed. You also detail every client contact that you've had. So whether that's therapy or groups, or any other individual work that you might be doing. So you just detail how how often you saw them, each session, what you covered, what the homework was if you're doing sort of therapy stuff, how long that session was for, and you also log any discussions that you've had in supervision, so about that case or general stuff. So let's say you're working with a client with OCD. In supervision, you might discuss the formulation, you might discuss what next steps to go, you might discuss the sort of treatment plan, which will be more kind of case specific. And then the generic stuff will be, are we using an outcome measure that's OCD related? How are we having those conversations about OCD? How are we psychoeducating about OCD? What sorts of models are we using? That generic stuff, and actually things like how are we assessing and formulating, so that general stuff that isn't just case specific. So you have to detail basically everything, and like I say, any of the other stuff that you've done, so any audits or presentations, training, all of that stuff as well. So that this logbook is important because it details everything that you've done on placement. So it's used in your mid-placement review, which I will come on to, and it's also used at the end of your placement to just show, this is all the stuff that I did. You can see all of the hours that you've done. So yes, and if you are a trainee or soon to be a trainee, my top tip is to do it as you go along. Like, start it immediately on your placement and get your head around it, get used to using it, put it in a format that you like, and just do it as you go along. Because I've been on placement 5 months. If I now tried to think back, I wouldn't be able to. So do it as you go is my top tip. So it feels like I'm doing it all the time because I'm always updating it, but yeah, that's a recommendation. Sometimes we also have to do an older adult logbook. So that's just to ensure, it's very similar to the clinical logbook, and you would log cases in both, I think. But it's similar to that, but we particularly focus on the work that you've done with older adults. So there's something about getting the hours that you need for older adults and working age adults, and making sure that you've done enough work with both. So that is useful. So depending on the course that you're on, and if there's any extra accreditations, you might also have to do logs or extra work for those accreditations. So, for example, if your course is BABCP accredited, you might have to do a cumulative log. So that details your whole 3 years on the course, and you have like a column for each placement, and you say how many cases, CBT cases you've worked on, how many hours of CBT, BABCP accredited supervision that you've had, any case presentations and reports that you've done that can count, and there are targets to meet for each of that. So depending on if your course has other accreditations, you might have other little logs to keep as well. And again, with any log, I would just do it as you go along. I really would. So moving on to kind of the assessment part, sort of, another requirement is structured observations. So obviously we're trainees, we're here to learn, we are here to observe people, see about how we can implement some of those things into our practice, and have our practice observed. So these aren't formalized kind of assessments, but on our course we have to do at least 2 observations of our supervisor. So we need to sit and watch them do a therapy session or an assessment, and kind of write an observation about what they did and perhaps why they did that, and actually what were you curious about that you could maybe put in. And then the supervisor has to do at least 2 for informal observations of you as well. So that kind of is a helpful nudge in the right direction before you're actually directly assessed. So then we come on to the direct assessments of clinical competence, which our course calls the DACs, DACC. So you need to do at least 2 of these over the course of the placement. So these are generally kind of validated measures of therapeutic skills. So for the CBT, it's the CTSR, that kind of checks that you're setting an agenda appropriately, and keeping to time, and doing appropriate interventions, and setting homework, and maintaining a therapeutic relationship. You get scored on each of those things. And you have a pass mark on that. In first year on our course, it's slightly lower, I think, but it's still, so you still need to be able to pass 2 of those. And these can be quite scary, obviously, because you can fail them. I failed one, but actually it gives you so much scope for learning, and actually the next one I passed, and it wasn't really a problem. So it was that was really helpful. It was as much as a difficult experience it was, particularly when you're dealing with feelings of imposter syndrome, it is really helpful because you can say, oh yeah, I know that I shouldn't do that again. I won't do that again, and you learn. So yes, that is really useful. Now these DACs can be done live, so your supervisor sits in a room with you, with a client, and watches you do these things, or they can be done based on recordings, which for my placement, the way that it's worked out, I tend to do recordings and get them listened to, which is, again, terrifying, but in a slightly different way, in a slightly delayed, detached way than if the supervisor was in the room. But anyway, those are the ways that DACs can be done. And as I say, you need to have at least 2 of those over your placement. So another thing that we're assessed on is the case report. So we need to write 1 case report, which is kind of just like writing up a case study, where we have done usually at least 5 sessions with a client, have appropriate measures of progress, either through outcome measures or goals, kind of progress towards goals. Generally, it will be outcome measures unless there's a clinical reason that is not advised. This is written up and submitted by the end of our placement. So for the first placement, which is what I'm coming towards the end of now, your course tutor, so that is your sort of supervisor while you're on the course, and that's related to to the course structure. They're a member of staff on the course. They can read it and give you some pointers on like some of the things that you might want to include and the structure of it and things like that. But that's only on your first placement. For the rest of them, and for your first one as well, your placement supervisor is the person that really will give you lots of tips about what to write, and making sure that you're writing it coherently and actually that it's an accurate representation of what you did. So in order to ensure that, one of your DACs, your direct assessments of clinical competence, has to be related to your case report. So again, if your course has additional accreditations, you might have to do other things. Like if you're BABCP, like you need to do a certain amount of CBT case reports or presentations. If you're AFT, so the systemic body, then you might need to do a systemic case report. So yes, there might be other things that you need to do, but generally this case report needs to be written up and submitted by the end of your placement. So those are the kind of assessment bits that you need to do, and the way that it's kind of the placement is sort of structured, I suppose. You have a mid-placement review, which I've had lots of questions about because I had mine a few weeks ago, and I posted on Instagram about it. So your mid-placement review, where you kind of, I will explain that in a minute, but you essentially review just what the progress is and make sure that you are meeting what you need to meet. And then you have an end of placement review, which I will also talk about. So what is a mid-placement review? So this is basically a meeting with your course tutor and your placement supervisor to ensure that everything's on track, or that there's an action plan made, if not, to address those things. There is a form to complete that the course provides. So your placement supervisor rates your competence in lots of different areas. So it might be things like able to establish consent, reflecting on how your own values might impact practice, things like that. And they rate you in our course from needs attention, satisfactory, good, excellent, and not applicable. And you also get written feedback on some of those bits as well. So if there's bits that are marked as needs attention, you'll probably get some comments on that. So yes, that kind of helps form some discussion really in the review. On that same form, we also, as the trainee, rate our supervisor and our placement generally on lots of domains, like, are we getting good constructive feedback? Are all our questions answered when we need them to be? Is the support there? What's our workload like? Is it manageable? Are we meeting those competencies? And you also provide written feedback on those things as well. So that form, as I say, is used to kind of guide the discussion in the meeting. So in terms of structure, the mid-placement review is split into 3 mini meetings. So you will meet with your course tutor first to kind of talk about the form, talk about whether there are any issues that are really important to bring up today. Then your course tutor will meet with your supervisor. So it's effectively like you're sat outside and they're talking about you, although at this time it's all happening online. So your course tutor and your supervisor meet. And then the third bit is all of you together meet. So at the end, an action plan is kind of agreed to ensure good things to continue and the bits that are needed get done. So that can be quite a scary process, really, because it's the first time. It could be the first time you're getting feedback. It could be the first time that you're really looking at every domain of the placement to make sure that you're doing everything right. And it's quite a lot, really. And I think you need to be in a place of like, yes, okay, I know that I'm going to get like feedback, positive and negative, and it's all okay, basically. Like, no one's ever going to get completely positive feedback. We're trainees. We're not perfect. No one's perfect. But a tip there is to just take that mindset, if you can, of, okay, I know that it's going to be okay. Essentially, all the feedback is okay. And if you were, the mid-placement review is a really good place to identify, actually, if things are heading towards you're not going to pass the placement, not able to get all those things done, then it's a really good place to put a plan in place. So the end of placement review is very similar. You will review that mid-placement review form. It's generally sort of more of a paper exercise if you're on a split placement. So mine, I will be meeting with my placement supervisor to kind of go through the paperwork and make sure that we have done everything that we need to do. So essentially that's what you're doing. You're just reviewing the form, making sure that everything has been done, and putting a plan in place if there isn't, alongside the course. So by the end of your placement, you should do all your observations, your DACs, and your case report should be completed. The other kind of focus of an end of placement review is that you will get general feedback on things that broadly you did really well, and actually broadly what would be helpful for your next placement for you to focus on. So that can be really useful going into your next placement, because when you go into your first placement, you don't have anything to say, oh, I really need to work on assessment and formulation skills, whereas you might have that going into your second. So that's really useful information to go in with. So yeah, I think it can be very difficult going into your first placement because you don't really know, like, you don't know how long this stuff takes. Some of my key reflections: 6 months is not a long time. It seems like it is, but it comes around so quickly because you're just so busy. And as well, I've never worked part-time, like in a clinical role. I've only ever worked full-time, and going down to 3 days, even though yes, your workload is sort of adjusted, in some ways it is, in some ways it isn't. You're not going to be expected to see 10 patients, for example, because you're not going to have the time in 3 days to do that. But like you would be on 5 days on a full time, but you also have loads of other things that you need to do. So I think it takes you some time to be like, okay, I've only got 3 days. Like it's a different shift. And I think now I have a better idea of how quickly the time goes and what the requirements are. I feel more confident going into my next placement to kind of stay on top of things, I think. The other reflection I have is that it takes a lot of organisation. Like, I feel like I am dedicating a really good hour each week. I would say it's probably more than that. It's hard to quantify, but I reckon a good hour I am spending with a diary and a computer diary, like making sure that actually I'm doing everything that I need to do. My list of deadlines is there, so I know when they're coming. I know how much time I'm going to have to do things. So like for our case report, if we can, we should get 2 days on placement to be able to do that, to write that up. But realistically, that doesn't always happen. So it's just making sure that you are planning and looking at your diary and trying to fit all this stuff in. It can be a lot. And don't underestimate that, is my advice. But it also depends on who you are. Like, I feel better when I've got everything written down and planned. It makes me feel on top of it and helps me to relax. But for some people, actually, that's quite stressful. So do whatever works for you is, again, my advice. But remember as well that your placement is 3 days. You're on teaching for 2 days. So that's your full working week. But alongside that, we're doing a foundation course in systemic. So that means we have other assignments to do and extra reading to do. I think it's 120 hours of independent study. So there's that. So the systemic, as well as our placement. And then we've got to do 3 research project proposals by the end of the year, so they all have to be approved at sessions. So you're also trying to fit in research meetings with supervisors to go through the proposal, and also find time to do the reading for each of those and make sure that they're viable, as well as making sure that you are doing your placement. So you're doing your client work, you're preparing, and you've got enough time to do that, to do your logbook, to do your case report, to get your observations done, to do your recordings and to manage all of that. And you also have to take annual leave on those days. Like, you have to take annual leave on placement days or study days, because you can't miss teaching. So that becomes very difficult as well, because suddenly you lose 9 placement days, which is a lot. And I think a lot of people end up working on annual leave because it's just so hard to fit in. Yeah, I mean, in terms of study days, we are on a run of about 4 weeks having study days every Friday, which has been incredible. It's been so useful, and I feel much more productive and calm because we have time, the gift of time. But that isn't always the case. They're generally quite good, I think, at trying to give us study days around deadlines, it seems like. But yeah, it's just hard to juggle a lot, really. But I know I've laboured the point about it being really busy and having loads to do, but hopefully that gives you an idea of how much there is to really consider. Because I don't think I was prepared for just the amount of organisation that I'm going to have to do, and I've never had to dedicate that much time to being organised. But it is really rewarding, on those moments when you feel like you're on top of it, fleeting though they might be, and those moments when you might have submitted something, or you've got to a place where you're like, oh, I understand my research project, okay, I can write this now and I can do it. On those moments, it's brilliant because of how hard you have to work. When it pays off, or you get even a little payoff, it's really great. And I would also advise, I may not be very good at taking this advice, but I'm trying to think about the positives. So, like, I submitted one of my assignments today, a couple of weeks early, and I'm so pleased to have just got that done and got that out of the way. And I'm really trying to be like, this is good, enjoy, relax, it's okay, that's no longer hanging over you. So I would definitely try and do that. Thank you so much for watching. I hope it's been helpful to see all of those things that we have to do on placement, and do remember that it might vary across the courses. I'm sure that it does, but I can only speak for mine. Let me know what else you'd like to see down below in the comments, and make sure you follow us on Instagram. I tend to post more on Instagram than I do on YouTube, so you might see lots of updates. I also do a monthly Q&A on Instagram, so you can ask me anything, generally about the DClin, but you can ask me anything and I'll see if I answer it. But again, thank you so much for watching. Take care. Bye.